12. Fatal traps that lead to devastating falls and fractures. Have you ever wondered why so many seniors suffer devastating falls in their own homes? Did you know that a simple fall can reduce the life expectancy of an elderly person by up to 5 years? Can you imagine that 70% of femoral fractures in the elderly result in permanent loss of independence? The statistics are alarming, but what is most worrying is that most of these falls could easily be avoided with proper knowledge. The difference between an active and healthy life, or years of dependence and suffering, may lie in the small decisions we make every day. Every 11 seconds, an elderly person is seen in American emergency rooms due to falls, according to the Centers for Disease Control and Prevention. This is a public health problem that affects millions of American families annually. But it doesn't have to be that way with you or your loved ones. Today, I'm going to reveal 12 fatal pitfalls that cause devastating falls in seniors and how to avoid them with simple and effective measures. Pay close attention because what you are going to learn can literally save the life of someone you love. Let's get started. Mistake 1. The invisible minefield. Is your home full of dangers? Did you know that 80% of falls in the elderly happen at home, the place that should be the safest? Loose rugs become real traps when not properly fixed to the floor. Electrical wires scattered along the path are almost invisible obstacles that can cause fatal trips. Furniture positioned in inappropriate locations creates narrow corridors and makes safe passage difficult. Objects left on the floor, such as shoes, magazines, or grandchildren's toys, become unexpected dangers. A disorganized environment is not only an aesthetic problem, but a real threat to the physical integrity of the elderly. Coffee tables with sharp corners pose additional risks in case a fall occurs nearby. Unmarked steps between rooms are particularly dangerous when the person is distracted. Stairs without adequate handrails or with irregular steps multiply the chances of serious accidents. Heavily waxed or polished surfaces can become extremely slippery and dangerous. Excessive decorations may seem harmless, but they reduce the space for safe circulation in the home. And if your home has these risks, imagine the danger when visiting family homes that are not adapted to receive the elderly. Mistake 2. The darkness that deceives. How the lack of light can be costly. Can you walk safely in an environment you can barely see? Dark hallways between the bedroom and bathroom are perfect backdrops for nighttime falls. The vision of the elderly, already naturally reduced, is even more compromised in environments with inadequate lighting. Switches positioned far from the entrances of the rooms force the elderly to walk in the dark. Proper lighting is not a luxury, but a vital necessity that can prevent life-threatening accidents. Environments with extreme contrasts between light and dark areas confuse the visual perception of the elderly. Lights that are too bright can also cause glare and temporarily hinder vision. Burnt-out light bulbs that are not replaced immediately create danger zones around the home. Motion sensors are small investments that can make a big difference in fall prevention. Nighttime lighting of the path between the bedroom and the bathroom is especially critical to prevent accidents. What would you do if you needed to get up in the middle of the night in a totally dark environment? Mistake 3. The most dangerous zone in the house. Is your bathroom a trap? Did you know that the bathroom is considered the most dangerous room in the house for elderly people? Wet and slippery floors are responsible for an alarming number of serious falls. Glass stalls without adequate signage can be mistaken for open spaces by the elderly. Getting in and out of the bathtub without adequate support represents one of the moments of greatest risk. The bathroom combines all the perfect elements for a fall: water, hard surfaces, and restricted spaces. Toilets that are too low make it difficult to sit and stand up, putting excessive pressure on the joints. The lack of grab bars near the toilet and in the shower stall is an omission that can be costly. Bathroom mats without non-slip slide easily when stepped on, causing imbalance. Hygiene products positioned in places that require risky movements to reach them increase the risk. Bathroom doors that open inwards can make it difficult to get help in the event of a fall. What if you knew that adapting your bathroom costs much less than a single hospitalization for fracture? Mistake 4. The cheating footwear. what your feet are trying to tell you. Have you ever stopped to think that your shoes may be putting your health at risk? Loose slippers without heel support are open invitations for stumbles and slips. Shoes with smooth soles lose grip on wet or uneven surfaces, causing imbalance. Shoes that are too tight impair circulation and sensitivity of the feet, affecting balance. The ideal footwear is not a matter of fashion or aesthetics, but a fundamental safety equipment. High heels, even low heels, alter the center of gravity and seriously compromise stability. Shoes that are too large or wide allow the foot to slide inside them, destabilizing gait. Untied shoelaces are responsible for numerous falls that could be easily avoided. Worn soles lose their grip capacity and become extremely dangerous. Inappropriate footwear can cause pain and discomfort that alter the natural way of walking. How much is it worth investing in safe footwear when compared to the cost of a prolonged hospitalization? Mistake 5. Pride that hurts. Why refusing support can be fatal. How many times has pride prevented you or someone close to you from accepting needed help? Canes, walkers, and other assistive devices are often rejected for vanity reasons. Many older people see these aids as symbols of weakness, when in fact they are tools of independence. Refusing help for simple tasks like climbing stairs or getting up can result in serious accidents. True strength lies in recognizing our limitations and using all available resources to live better. Properly adjusted support devices significantly reduce the risk of falls. Handrails installed at strategic points offer additional safety in times of imbalance. Resistance to using walkers in public spaces exposes the elderly to unnecessary risks. Shower chairs and raised toilet seats are simple adaptations that prevent accidents. Procrastinating the adaptation of the house with grab bars for aesthetic reasons can have serious consequences. Which is more important, maintaining appearances or preserving health and independence for longer? Mistake 6. The seemingly harmless move that causes disasters. Did you know that getting up quickly from bed or armchair is one of the main causes of falls in the elderly? Postural hypotension, a sudden drop in pressure when changing position, affects up to 40% of the elderly. Many ignore the need to gradually transition between lying, sitting, and standing positions. Standing up abruptly can cause dizziness, blurred vision, and even momentary fainting. Those few seconds of patience when changing positions can be the difference between safety and a serious accident. Rapid rotating movements, such as turning to answer the phone, can trigger vertigo. The rush to answer the doorbell or phone is often responsible for avoidable falls. Bending over sharply to pick up objects on the floor changes the center of gravity and causes imbalance. Simple gestures such as looking up quickly can cause dizziness in more vulnerable people. Older adults who take certain medications are even more susceptible to these episodes of instability. What if you knew that just 30 extra seconds of lifting could prevent a devastating fracture? Mistake 7. Silent remedies that knock down. Are you taking any of them? Ever wondered if the medications that are supposed to help might be causing dangerous falls? Diuretics, antihypertensives, and psychotropics often cause dizziness and loss of balance. Many older adults take multiple medications simultaneously, increasing the risk of dangerous interactions. Sedatives and tranquilizers, even at low doses, can significantly compromise reflexes. Polypharmacy, use of multiple medications, is a silent risk factor that multiplies the chances of falls. Sleeping pills stay in the body longer in the elderly, affecting stability in the morning. Common antihistamines in cold medications can cause drowsiness and reduced attention. Some diabetes medications can cause episodes of hypoglycemia and consequent disorientation. Opioid analgesics, often prescribed for chronic pain, alter spatial perception. Self-medication, a common practice among the elderly, considerably increases the risks of adverse effects. When was the last time you or your elderly family member had a complete medication review with a doctor? Mistake 8. The liquid danger. How dehydration robs you of your balance. Did you know that most seniors live in a chronic state of mild to moderate dehydration? The feeling of thirst decreases with age, causing many not to notice when they are dehydrated. Even mild dehydration can cause mental confusion, dizziness, and muscle weakness. Dehydrated seniors have slower reflexes and a lower ability to regain their balance after a stumble. Water is not only an essential nutrient, but a fundamental component for maintaining motor coordination and balance. Many avoid drinking water to reduce trips to the bathroom, especially at night, increasing the risk of falls. Caffeinated drinks and alcohol worsen dehydration due to their diuretic effect, further compromising balance. Air-conditioned or very heated environments accelerate the loss of fluids from the body. Some medications increase the need for hydration, a fact often ignored by doctors and patients. Severe dehydration can lead to sudden drops in pressure when standing up, resulting in fainting. How long would you go without water to avoid a trip to the bathroom at night? Mistake 9. Eyes that do not see, body that falls. Fatal visual neglect. When was the last time you or your elderly family member had a complete vision exam? Uncorrected visual problems increase the risk of falls by up to 3 times in older people. Many older adults postpone changing glasses, using outdated prescriptions that compromise spatial perception. Conditions such as cataracts, glaucoma, and macular degeneration drastically affect the ability to see obstacles. Vision accounts for 80% of the information we use to keep us in balance and avoid danger. Bifocal or multifocal glasses, although practical, can distort the perception of steps and unevenness. Improper adaptation to new glasses is a particularly risky period for falls. Environments with insufficient lighting further aggravate pre-existing visual difficulties. Many elderly people have difficulty seeing contrasts, not noticing subtle steps or unevenness. Reduced peripheral vision limits the ability to detect side obstacles while walking. Is it worth saving on eye care when the price can be a devastating drop? Mistake 10. Sleeping muscles. The high price of physical inactivity. Did you know that after the age of 50, we lose about 1 to 2% of muscle mass annually without exercise? Muscle weakness, especially in the legs, is one of the main risk factors for falls. Many elderly people abandon physical activity just when they need it most to maintain stability. Inactivity creates a vicious cycle. The less you move, the weaker you become, and the greater the risk of falling. Regular exercise is not only a recommendation for seniors, but a vital necessity for their safety. A sedentary lifestyle directly affects balance, coordination, and reaction time in situations of imbalance. Strong muscles act as natural airbags, protecting bones in the event of an impact. Simple exercises such as walking, swimming, and Tai Chi significantly reduce the risk of falls. Physically active people have better bone density, suffering fewer fractures even when they fall. The loss of flexibility resulting from inactivity makes it difficult to regain balance after a stumble. What if you found out that just 30 minutes of exercise 3 times a week could prevent a fracture? Mistake 11. The wrong fuel. How your diet is weakening your bones. Have you ever considered that your diet may be quietly weakening your bones? Diets low in calcium and vitamin D directly contribute to the weakening of bone structure. Many elderly people consume insufficient proteins, essential for maintaining muscle and bone mass. Excess sodium in the diet increases the excretion of calcium through the urine, damaging the bones. Proper nutrition not only prevents chronic disease, but it is critical for maintaining strong bones and muscles. Soft drinks and ultra-processed foods contribute to the acidification of the body, affecting bone health. Malnutrition, common in elderly people who live alone, compromises the immune system and tissue regeneration. Vitamin B12 deficiencies can cause neuropathies that affect the balance and sensitivity of the feet. Excessive consumption of caffeine and alcohol interferes with the absorption of essential nutrients for the bones. Self-imposed restrictive diets often result in severe nutritional deficiencies in the elderly. What is the real value of saving on nutritious food when compared to the cost of a femur fracture? Mistake 12. The ignored signs of osteoporosis. When your body screams and you don't listen. Do you know how to identify the warning signs your body sends when your bones are becoming brittle? Osteoporosis is known as a silent disease because it progresses without symptoms until a fracture occurs. Decreased height, stooped posture, and back pain are signs that are often ignored. Fractures due to minimal trauma, such as a strong sneeze, are serious warnings that many disregard. Osteoporosis is not an inevitable consequence of aging, but a preventable and treatable disease. Many people are unaware that there are effective medications to strengthen bones and prevent fractures. Bone density can be measured through simple, painless tests that many overlook. A family history of osteoporosis significantly increases an individual's risk of this condition. Early menopause, long-term use of corticosteroids, and certain chronic diseases are important risk factors. Early diagnosis can make the difference between an active and independent life or severe limitations. What if you found out that a simple bone densitometry could prevent years of suffering and dependence? The life you save can be yours. How to act now. Right now, you have in your hands powerful knowledge that can literally save lives. Falls in the elderly are not inevitable accidents, but predictable events that can be avoided. Each of the 12 mistakes we have discussed represents an opportunity for intervention and prevention. The difference between independence and dependence often lies in the small changes we implement. Prevention is much more humane, cost-effective, and effective than trying to recover damage after a serious fall. Start today by assessing your home, or that of your elderly family members, with a critical eye to identify risks. Schedule medical appointments for medication review, vision exams, and bone density assessment. Gradually introduce physical exercise appropriate to your age and physical condition, preferably under professional guidance. Don't wait for the first fall to take action, as it can be the one that changes everything. Share this information with family and friends, because knowledge that does not spread saves only one person. Remember that taking care of health and safety is not a sign of weakness, but of wisdom and self-love. True independence in old age comes from accepting limitations and making intelligent use of available resources. Every adaptation, every change of habit, every visit to the doctor is an investment in future quality of life. You have the power to transform not only the physical environment, but the mindset about healthy and safe aging. The time to act is now, not after the first fracture or loss of mobility. May this knowledge be the first step in a journey of dignified, safe, and independent aging. Your life and that of your loved ones is worth every effort to create a safe environment and protective habits.